Good evening, folks. We should be going underway in the next 2 minutes or so. Hanas, can I just confirm you can hear me, right? If you can just kind of send me a message on the group, that should confirm that you can hear me. If you're there, that is. Hi, Mariam. Nice to have you on board. Can anyone just send me a quick message on the chat to make sure that you can hear me just before we kind of start? I'm not really too sure if you're able to hear me, but I think you should be able to. Perfect. Isha, thank you very much. I appreciate that. Right, let's get cracking and let's go live. So here we go. Let's have a look. Okay. Okay, I think you should be able to see me now. I can't really see myself, which is not normal, but I'm just going to quickly check. Give me a second. Continue. Company participants will be muted. Continue. Right. Resume share. And can you see me? I'm guessing you can't, which is weird. Let me start this again. Okay, you can see me. Perfect. Right. Which is normally I can kind of see myself, but I can't see myself. Not that it matters too much anyway. Right. So let's share this screen. Let's get cracking on. Perfect. Rihanna's, if anything does kind of like go weird, just send me a message because you've got my number. So inshallah, we'll take it from there. Right. Good evening, folks, and thank you for being here today. I just want to start off by, first of all, thanking all pharmacists for absolutely all the hard work that you've put in as, as a profession, as a team, because with the current situation the way it is, it's definitely not easy, and it sometimes can be quite upsetting when you don't get the mention that we deserve, right? But it's good that Boris has finally decided to mention pharmacy and pharmacists and how important we are to the cause and everything that we're doing for the public. So again, hats off to you all, and stay safe, most importantly. But basically the plan today is to show you how, with the help of MedLearn and with the right training, you can develop your clinical skills without spending 5 months of your life studying. Now, I have spent ages, and you can write this book down. It's known as the Bates book on physical examination and clinical history taking. And it's like 1,000 pages. So you could imagine reading 1,000 pages is one thing, but really understanding and being able to retain that information is a totally separate thing altogether. So that is always something important to keep in mind, that you don't always have to reinvent the wheel, and you don't need to spend 5 to 6 months on developing your clinical skills when it can be done for you if you know how to. That's basically the plan. First of all, why even bother developing your clinical skills? Something really, really important to understand is, why do you want to develop your clinical skills? And for me, I decided to list just a couple on here. And this is going to be a bit of soul searching for everyone. It's going to be really important for you all to kind of really to have a think about, why do you want to develop those skills? And for me, what was really important was to really go back and think, why is it that I became a pharmacist? Why did I become a pharmacist? And why is it I do what I do? And I keep bringing up the why because it's so important. Doesn't matter what you decide to do, on why is it you do what you do. And after some soul searching, looking at myself and looking past materialistic things like having money, having a big house, having cars, which is fine, which is all important because, I'm an advocate of that. Enjoy your life, but there's got to be something more that drags you out of that bed when it's cold outside. There's got to be something more that drags you out every single morning when you go out there and do what you do what you're good at, and you don't get the appreciation that you deserve. And for me, it was all about bettering lives of others, helping patients, and making a difference to others. Because when you can make a difference to others' lives, there is no better reward, in my opinion. So for me, I thought, you know what? I'm kind of tired of this monotonous sticking a label on a box, acting as a, as some people will say, glorified dispenser, whatever you want to call it. It just wasn't challenging for me. And I thought, you know what? This process can be streamlined and it can be done a lot easier, and it doesn't require a 4 years master's level education to do that. So I thought, you know what? There's got to be something more to it. So one of the main things was, first of all, is helping patients and make a difference to people's lives. That was what it was for me. Then it was also understanding, really important to understand that if you're in any medical business or you're in any medical field in this country, you need to understand the NHS. You have to understand the NHS. Why? Because they're your biggest paymaster. Even if you decide to go into the private sector, which is fine. And, some people do regard pharmacy as a private sector, and it's because, apparently in theory, we have a contract that the NHS provides us and we provide NHS services. So it is really, really important for you to understand the vision of the NHS. Where do we see the NHS going? What does the NHS require now? And we know shortage of doctors, shortage of nurses, there's an increased demand for healthcare. Resources are finite. The NHS is crying for help. How I see it is you've got a professional who's accessible. You're the only healthcare professional that can be seen in a community setting without an appointment. You have a consultation room. You have the skills to work on to develop your clinical competency. For me, pharmacy is a huge opportunity and a solution. But in order to benefit, to understand what the NHS wants. And I'll leave some references. There's plenty of papers out there that will tell you what the NHS is looking for, and we can discuss that later on. Also, if you want to innovate in your business, you could be a pharmacy owner. And let me tell you something, folks, as a pharmacy contractor, if you are still relying on dispensing and you think that's going to get your business through, ain't going to happen. If it's not going to happen this year, then definitely next year, it's not going to happen. The NHS cuts are there. The NHS cuts are staying. 2.59 billion is what they have allocated to us, and that money is fixed. So once you start to think about inflation, and you start to think about how that's going to affect your business, you soon realize that it's, some people have called it like a death trap. So ultimately, if you're going to keep doing the same things and expecting a different result, it's not going to happen. So you might want to innovate in your business, and I'll show you how you can do that. Maybe you're thinking, you know what, I'm not a pharmacy owner. I want to set up my own business, but I want to do it in something that I enjoy, and I want to do it in something that's risk-free. Like I set up my, my minor illness clinic. And maybe you just want to do what you enjoy. If I was to show you, and if I get a chance in my living room and I've got my wife just sat there who's smiling, you'll just see books and books and books. I've got, if I showed you books and in my oh wait, I don't want to bend my books because I'm a bit, I really enjoy my books, but there are books and books all over this page because I genuinely really enjoy what I do. And yesterday when I was speaking to some of my students at the mastery program, and I got my wife who's is practicing soon as a gynecologist, and we basically spoke about why I've managed to do what I have in such a short space of time. It's because I just enjoy what I do. I absolutely love what I do. And if you ever want to buy me a gift, get me a book. So, maybe you just want to do what you enjoy. And also, if you haven't understood this by now, and I'm happy to spend time and we can argue day and night. If you haven't understood that you need to develop your clinical skills first before you do your prescribing, then I haven't got my message across to you clearly enough. Have a look at the GPHC registrant survey. Have a look at the survey that was done 2 years ago and the surveys that was done recently. Have a look at Nabila yesterday, who's one of the associate directors at Babylon Health, who said exactly the same thing, that pharmacists lack clinical skills. And when you put them out their comfort zone, things start to fall apart. We had 2 or 3 students, yesterday speak about, oh, how do I get into telemedicine and telehealth? Folks, if you don't know how to take a history, how to do a physical exam, don't understand your anatomy, don't understand the human body, how are you possibly going to reach a diagnosis over the phone when you don't have that person in front of you? Ask yourself that question. If you can't treat a patient face to face, how are you going to develop your clinical skills, and how are you going to treat someone on the phone? Because telemedicine, everything is done on a history. You're not seeing that patient. So just have a think about it, that it's so important to develop your clinical skills. So some of you might be here, you might be thinking, in the past, I've attended these webinars, I've attended courses, but I haven't succeeded. I've not been able to succeed at this. And that's fine. We've all been there. We've all been to courses. We've all attended different training, and you've come back thinking, okay, now what? Where do I go from here? And think about it when the last time and training and you really benefit from it. Have a think about that when you really benefited from your training. And I've been to courses and the next day nothing happened. And there's various reasons for that. It might be you lack support. You just don't have someone to speak with. You've got no one to guide you. I've also been hearing on social platforms that discouragement from others. That's horrible. Folks, if you are involved in any way or are negatively impacting people's lives, stop doing it. Mind your own business and focus on yourself. If someone wants to do something, if you can't encourage them, at least don't discourage them. Secondly, you yourself might be the biggest discouragement. You yourself might be telling yourself, I can't do this. I can't do this. I'm not capable of this. And it's a famous saying that the one who says I can't and the one who says I can, you're both right. Normally, you're both right. So don't discourage yourself. Don't be one of those people out of those thousands who are going to tell you it can't be done. And you're also telling yourself that everything is possible. When I did my mastery program and I set the price at £13,995, that's £13,995. People said to me, not even a single penny, no one's going to pay for it. We've got 10 students. We've got 10 students who've signed up for the course. All those people who doubted me, I've just sat there thinking, wow. Because if you give people value and you find a solution for them for a problem, people are happy from money. I don't doubt what I do, so you don't doubt what you do. Enjoy what you do. You might be scared of the unknown, and you're scared of prescribing, you're scared of aesthetics, you don't know what's going to happen, you're worried about litigation, which are important to keep an eye on. Maybe you're not knowing where to start. You might be one of those people like I was, where you don't know how to do it. How do you find a DMP? You've been knocking on that door, you've gone to surgery, they're like, not interested. Don't want to know you. Go away, or you're not relevant for us, and you've just given up and you don't know what to do. Could be that you lack a structure, that you've done your non-medical prescribing and now you're thinking, how do I use it? How many pharmacist colleagues do you know? How many pharmacist friends do you have that are prescribers and not using the qualification? They don't know what to do with it. But I'm a proof, won the Pharmacist of the Year last year, signed up 10 students on my mastery program. Alhamdulillah, helped so many pharmacists on the way. I regularly post on LinkedIn. Everything is possible if you know how to do it and you're with the right people and you educate yourself. You'll buy the latest phone, you'll buy the latest watch, you'll buy the latest car, but you won't invest in this. And that's the most important chip Your brain is the most important thing that you should be investing in if you want to enjoy what you want to do and you want to achieve your dreams. Knowledge. Knowledge is what's got you individuals here listening to what I have to say. Knowledge is what's now has given me the invitation when I'm paid to speak now at the pharmacy show. Now people are paying me to speak at the pharmacy show. Why? Because of knowledge. How things have changed. A year ago, 2 years ago, nobody wants to know. And now, alhamdulillah, with God's will, I'm making a difference to people's lives. I'm making a difference to my lives and others. People are happy to listen. And ultimately, that's what we want to do today. So I went on to develop MedLearn, and the vision was straightforward. It doesn't matter who you are, age, gender, race, what belief you are. Ultimately, we all have access. We all have a right to great healthcare. We shouldn't be worried about lack of ventilators. We shouldn't be worried about prescriptions. We shouldn't be worried about lack of doctors, lack of nurses, lack of clinicians. No one in the world should suffer. In this 21st century, no one in the world should suffer. And that's what my vision was. There had to be a greater cause. And I said, I want to develop clinicians. It's not going to be everyone. Not everyone is going to believe in what I believe in. Not everybody's values match what I do. So it doesn't matter. But as long as I can get a group of pharmacists together to match this belief, we're going to move in the right direction. And that's the students on our mastery program and you people here today. So that was basically what my vision is. And today's plan is to demonstrate to you the opportunities that you have if you upskill yourself. And I want to use myself as a case study to show you that. The financial reward, we've already touched on how I've signed up 10 students on my mastery program for £13,995. It's mind-blowing. And it's not even talking about everything else that I've done in the past few days. So to explain to you why upskilling yourself is now mandatory. It is not a matter of if, it's something that you have to do. You have to now develop your clinical skills. There is no if, it's when and how. I want to explain to you why history taking physical examination is so important and why you need to get out of this habit of minor illnesses. Why you need to stop running towards minor illness courses. And I want to do a minor illness course. I want to set up a clinic. It is not that straightforward. And I'll explain to you and show you why. And show you a case study of 2 or 3 students who are kindly happy to, discuss how they've benefited from upskilling themselves. So my journey briefly, I qualified as a pharmacist in 2012 with the help of my siblings, Wasim, Adnan, my sister Uzma, and with the mercy of God and my parents and family, we went on to set up a pharmacy business. It was a 100-hour business. So any one of you pharmacists who worked in a 100-hour pharmacy will know that it's a lot of hours. And I kind of found out the hard way because I was just working 8 in the morning till 11 at night, 7 days a week. And I never realized how, if you lack balance in your life, how it can destroy relationships. And it ended up with me having a divorce, which was just a horrible experience to go through that whole process. And it changed my life. Ended up with me having health issues because I wasn't looking after my health. And on top of that, we started having funding cuts. So here I am, had a divorce, having health issues, struggling to balance my life, struggling with family time. And then bang, the NHS says, okay, we're making funding cuts. 2014-15, after the NHS 5-year plan, first letter goes out to Sue Sharp, funding cuts start from there. The writing was on the wall. If you read, a document that was written by the RPS, Now or Never, Shaping Pharmacy for the Future, write it down. 2013, it spoke about everything, about how funding cuts are going to come, how the role of the pharmacist is going to be marginalized, how technology is going to play a big part, how you need to upskill yourself and start to change the views and the beliefs of those people who make policy. You have to start to influence those people who make policy, otherwise you're stuck. And that's what's happened today, why we've got all these funding cuts. So divorce, long hours, health issues, And on top of that, bang, NHS decides to make funding cuts. That's what happens when you have one paymaster. We have 6 of you here. We've got 4 of you on YouTube. There's some on LinkedIn. And if you were my only customers, then what you say goes. If I don't do what you say, you're not going to sign up to my courses. I'm stuck. Same thing with the NHS. If you don't do what the NHS says as a pharmacy contractor or a pharmacist, and you're not willing to develop your skills and to tap into the private market, you're not going to have a job. Simple as that. And you can reflect on this, have a think about it. You've got one paymaster, but we can change that. So then I decided to, okay, look, there's shortage of doctors, shortage of nurses. There's a huge opportunity. Everybody wants healthcare, but you can't get hold of it. So if I could develop my clinical skills and solve this problem that the NHS has and patients have, then there's an opportunity there, huge opportunity there. 95% of people in England can get to a pharmacy by foot. So you're obviously accessible. Have a look at it now with COVID-19. I have helped so many patients in my practice because some healthcare professionals, for valid reasons, have closed their doors. They can't see them. They come into my pharmacy. And our consultation fees, yes, they were around 30, 35 pounds, but I've scrapped that now. We only charge for the drug now because this is not the time. You know, I think that I have an opportunity to make difference to people's lives. I'm not really too fussed about my consultation fee, but as long as we get these patients well and out there, because ultimately you go back to your beliefs. But huge opportunity now I have, even prior to this. So you can develop your clinical skills, you have an opportunity, and I've done plenty of videos explaining the opportunities and proving to you how it can be done, other than myself as an example. But one of the mistakes I made was I spent too long finding a university. After I realized that I want to do this, I was so hung up on, I want to go King's, I want to go Imperial, I want to go Reading, I want to go to Leicester, I want to go to all these big university names. Folks, it doesn't matter what university you attend. You're a pharmacist, you're a master's level student. No one's going to ask you, oh, did you get your qualification from Open University, your non-medical prescribing? No one's going to ask you, did you get your qualification from, and again, no disrespect to Open, did you get your qualification from, I don't know, Kensington or whatever the other pharmacies are, or the universities are? Doesn't matter where you go. Ultimately, what people are going to see is you're a pharmacist, you're registered, can you treat? Do you have the skills and the knowledge to treat this patient? And I did have an issue with confidence. I'll be honest with you, when I qualified as a pharmacist and I got my prescribing, everything fell apart because I never realized that the non-medical prescribing course or the independent prescribing course does not teach you clinical skills. And if they do teach you clinical skills, it's not enough to make a diagnosis. 6 months, 26 days of study. Do you really think that you're going to be able to safely diagnose a wide range of conditions? Have a think about it, folks. Do you really think that's possible? If it was that easy, then why do doctors spend 5 years at university, 2 years foundation year 1 and 2, and then spend 8, 9 years on their practice? It can be done within a scope, but you can't become a doctor by just, and prescribe for anything and everything you want. So then what happened was I couldn't use my non-medical prescribing. I then went into aesthetics. And heads up advice to anybody who wants to do aesthetics. Aesthetics is great, do it, but there's a lot of competition. There is a lot of competition in aesthetics. Doctors, nurses, cardiologists, dermatologists, the next door beautician, even she can do it. So yes, it's important to develop your clinical skills on aesthetics, but it's also important to market yourself and be able to get your story and vision out there to your patients. So again, that's something that we can discuss if you're interested in aesthetics and developing your aesthetics practice. But heads up advice, if you're going to be doing aesthetics, make sure you have a marketing plan. Otherwise, you're going to be sat there with your aesthetics qualification and you're going to be wasting your time because you've not thought about it. So anyway, I understood this early that I need to develop my marketing strategy, and things started to do well. In my aesthetics business, just working 3 days a week, I earn around 10 and a half, £12,000 a month, which was great. And then I went back to the real issue, which was, my prescribing, because what I realized is Fahim can open up an aesthetics business, Lisa can open up an aesthetics business, Pfizer can open up an aesthetic business, Mariam can open up an aesthetic business. Any one of you on the chat, Anika, Isha, Rihanna, Tawfiq, any one of you can open up an aesthetics business. There's nothing stopping you from doing that. But if you could prescribe, diagnose, and treat, that is not easy. That separates you from the rest, because now you have an aesthetics clinic and you've got a clinic where you can treat, manage, and diagnose patients and offer a holistic view. That separates you from any business. Imagine you could walk into a shop. I don't want to call it a chemist, because if you're a pharmacy owner, and one of my mentors is on the chat today, and it'd be interesting to get his thoughts, Tawfiq, who again, thank you, Tawfiq, for all the support that you've given me over the years. If it wasn't for you, I wouldn't be here teaching today. But if you think and you're not redefining your business and you're still a pharmacy, it's not going to work. Imagine now you could go to this building where they could treat you for minor illnesses, aesthetics, give you advice on weight loss, give you advice on nutrition, look at your, what you're eating, give you advice on sleep, and prescribe for minor illnesses and do aesthetics. You can never go out of business. And then you decide to teach, because you've got a skill, you decide to teach it. Why not? I get to enjoy what I do now. I've done the hard work. I get to enjoy what I do. That was my vision, because I realized, and interestingly enough, down the door in our branch in Oxford, and Tawfiq, you'll know about this, Superdrug have bought a premises, and all they have is a retail space, and they have a nurse inside. She does travel, she does advice, she's doing her non-medical prescribing or independent prescribing, and soon they're setting up their clinic. Because these big chains are realizing that it's, eventually, personally, I feel there's going to be two contracts. There's going to be those that do services and those that do dispensing model. And I don't know if we can compete with Amazon on dispensing. I'll leave that up to you. But that was my thinking. Then I did my learning, got in touch with doctors, developed my clinical skills. I have, again, a lot of people on LinkedIn don't really understand that I have a huge network, from A&E consultants to dermatologists to chiropodists to plastic surgeons to GPs to pediatric surgeons. I can pick up a phone now and I can give any one of those doctors a call, and they will be able to support me right now. And in actual fact, one of my teachers, Dr. Thazeen, is actually on the chat as well today. So I have a huge network. When you see me posting videos, alhamdulillah, I have a network that I'm working within my comfort, within my zone. And it's important to make sure that you're always practicing safe. I went on to win the Pharmacist of the Year award, had an article written in the Chemist and Druggist. I've now been invited, or was invited, I don't know what's happening at the moment with COVID, to speak at the Strategic Transformational Planning NHS in London, to see how Medland can support NHS to develop pharmacists and their clinical skills. And again, thank you to Jignesh Patel for that. So there are huge opportunities. Just by sharing my story and by teaching, it's in front of you. But the thing that you want to realize is you don't need to reinvent the wheel. You don't need to spend, it's taken me 3 years. You don't need to spend 3 years doing what I'm doing when you can have a solution. And it doesn't matter where you go to. The moral of the story is educate yourself and upskill yourself. So step one is history taking and physical examination. Ask any clinician, whether it's a nurse or it's a doctor, how do you reach a diagnosis? They will tell you 80% of the diagnosis is in the history. And we'll get into that, how you relate to that in a second. So quickly, some of you students had asked me, how do I become a non-medical prescriber or an independent prescriber? First of all, understand that you need to develop your clinical skills either alongside your prescribing or before you do your prescribing. Don't waste your time like I did. I got my prescribing qualification, then spent 3 years educating myself. If you want to waste your time or you feel you've got that time, fair enough. I don't think it's the right way to do it. Up to you. Secondly, don't waste your time on universities. Apply to different universities, find a space. Another thing that people ask me is about filling in the application form. If you need help with that, I'll be discussing how we're going to help you doing that. I've got one of my students, Farah, who's also, who's on our course, so I'm helping her. There's Lee as well, who I'm helping as well with their filling out the application form, because you have to be able to demonstrate these universities that you are ready for this and you have the right training in how you're going to develop your skills. Whether you're working in a primary care setting, whether you're in secondary care, whether in community pharmacy, they're going to ask you how you're going to use your skills. Then it's about finding a DMP. To find a DMP in a nutshell, keep at it. Keep asking all the different doctors in your locality that this is what I want to do, and give them something in return. If you think that they're going to spend 90 hours training you because for some reason you have a given right because of birth that they should spend that time with you, think again. Why should they? Why should they spend 90 hours with you? What do they get in return? And I'm not saying pay them. It doesn't have to be that. What I'm saying to you, what value can you give them in return? After I got rejected like a billion times, I then decided to rethink my strategy. I spoke with my elder brother, Wasim, and he said the same thing to me. What you giving them? What value are you giving them? So in return, we thought, okay, I can help them with their medicine optimization. I said, I'll help training your staff. I said, I'll do your hypertension clinics. I'll start to help with your DocMan. So I started to build up a list of things that I could do to support them in return for those 90 hours. Everyone accepted. If you're still struggling, we do provide you with that training. We do offer you a support, which we'll be going through later on how we can provide you with a DMP. If you're saying, look, Fahim, I've done all this, I've tried everything under the sun, I can't find a DMP, then we can help you with that. I can organize that for you. I have contacts in London, Birmingham, and all sorts of places where doctors are happy to support you. And we can discuss that later. We can do that. Also remember, it costs. When I did my non-medical prescribing, 26 days I attended, you have exams, you don't go to work. I calculated it as a business owner, it cost me about 12,000, 13,000 pounds. But for you, it might just be 26 study days. So 26 days times 8 hours at work at a rate of £25 an hour, plus your exams, that work out to about 7,000 pounds. Adding in your qualification, it works out to about, I think about £10,000, even if you did it without owning a pharmacy business. You'd have a locum to worry about. Factor that in. And then think about your exams. You're examined at pharmacology, law, and OSCEs. So there's a lot to think about before you do your non-medical prescribing. Why do most pharmacists struggle with the clinical skills? It's the mindset. Because the truth is, as a pharmacist, our learning is different. We're moving away from this having these clinical skills 7-8 years ago to now applying it. And the truth is, we've never applied those skills. Well, you do it over the counter, but we don't apply it to the level that you have to apply it here. Okay, and let me give you an example of this. Check this out. So we've got this patient here, and she presents with right-sided unilateral swelling on the face. So it's what we call hemifacial swelling. So this could be anything. It could be a dental abscess. It could be Ramsay-Hunt syndrome. It could be parotitis. It could be mumps. It could be a trauma. It could be possibly angioedema. I could list hundreds of things that it could be. So I'm asking you on this group, with all the students here, for you to reflect. Isha, Anika, Rihanaz, Tawfiq, all of you individuals here, reflect on this, how you would reach that diagnosis. How would you've got this patient who presents to your pharmacy, how would you diagnose that? Does this patient have parotitis? Is it viral? Is it bacterial? Is it a dental abscess? Is it mumps? Is it, is it because of trauma? Is it because of facial, is it because of, is it Ramsay-Hunt? What could it be? How would you diagnose that? And it's not just by knowing your minor illnesses, because you could know all the conditions inside out. Ultimately, what you'll need to know is these 15, 20 conditions that I know, How do I reach a diagnosis? For example, mumps. Mumps is normally mumps is bilateral. So you normally have swelling that's bilateral. So that's important in the history. Secondly, with mumps, you want to ask the patient, what about your vaccination history? Have you had your vaccinations? Thirdly, you want to ask your patient, is there, including these two for mumps. Secondly, you would have to do physical examination. Is there any sort of, tendon carotid gland around any of the salivary glands? If it's a dental abscess, for example, you need to say, was it sudden onset? Did it happen straight away? Did it happen after a bit of time? Do you have any sort of, you look in the oral cavity, is there any pain there? Is there any inflammation there? Is there any erythema? Do you have any dental pain? Because if this patient has no dental pain, she has no swelling, she has no issues with dental hygiene, you don't see anything there, maybe it's not a dental infection. We know that part of the inflammatory process, you do get redness, you get heat, you get inflammation, you get swelling. The common cardinal sign, rubor, calla, tumor, and there's there's rubor, calla, tumor, and there's I think there's heat. There's one more that are common cardinal signs of inflammation, but it's difficult to rule out what's causing that inflammation. So just because this lady has a temperature doesn't mean that it's definitely dental infection or it's something else. This picture on the right hand side, is it acne? Is it rosacea? How do you decide? Comes down to the history. Let's have a look at this patient. This patient on the left-hand side, this rash, this patient presented with she only presented with a history of pain and tenderness on one side on the back. That's all she had. And straight away I thought, you know what, might be the start of shingles, because when I took a history, did a physical exam, she had no trauma, but it was the history, the tingling, the predominal signs and symptoms, or the predominal symptom that she was having, that I thought, you know what, you might be developing shingles. 2 days later, she breaks out in this rash. Have a look at that rash. And it's characteristic because you've got the erythema or the redness. So that it's on this erythematous base. And there's tiny blisters that are clustered, but the rest of the skin is not there. It's not inflamed. So this was shingles. This here, on the right-hand side, how do you know that that's tonsillitis, that's bacterial or viral? How do you know if that tonsillitis is quinsy? How do you know if that tonsillitis is just, it is just tonsillitis? How do you know it's not infectious monoclinosis? How do you know it's not caused by herpes infection? If you look at the uvula, again, it comes down to the history. If the uvula is deviated off the midline, and you have one side that's more swollen, they have a muffled voice, they have a temperature, you're going on the realms of a peritonsillar abscess, which is quinsy. If this patient is between 14, 15, or 16, has got tenderness on the abdomen, they might have, splenomegaly, or they might have inflammation or tenderness about the spleen, and this, or they have, if you feel the cervical lymph nodes, and majority of them are tender, this patient might be suffering with infectious monoclinosis and not a bacterial infection, and you treat this person with antibiotics and they develop a rash. So just look at these pictures and you reflect on your practice. If I saw this in my practice, how would I make the differential diagnosis? Have a look at this gentleman. Have a look at this. This is, folks, otitis externa to its extreme. You can give this patient all the antibiotics you want. You can give him oral antibiotics, you can give him local antibiotics, but without using a wick, that's not going to it's going to be very difficult to treat that, because there's so much inflammation that the epithelial lining is so inflamed with discharge. If you treat this, it's going to be difficult without an oral wick because there's so much inflammation there. Have a look at that discharge. And you treat this patient with a glycoside like neomycin, and this person has a perforation, there's a risk that they might develop ototoxicity, a theoretical risk. How do you know? Because you've not been taught how to take a history, you've not been taught how to do physical examination, you don't have a clue. Going back to this picture, what about examining the cranial nerves? There's one thing examining the cranial nerves, but there's one thing you being able to relate that information back to the patient to make sure that patient's safe. This is why history taking is so important, and developing your clinical skills starts from there. Then you worry about knowing your diseases. And I've put this structure here for you folks. Take a picture of it. Write it down. Anytime that I'm seeing a patient, I use this structure. I think, is the patient unwell? Am I the best professional to help this patient? I always think observation, observation, observation. Have a look at your patient. Does this patient look unwell? How are they walking? What do they look like? Has this patient walked in huffing, puffing, clammy, sweating? Think about airway, think about breathing, think about circulation, you know. In addition to that, you start off by always introducing yourself. My name is Fahim, I'm the prescribing pharmacist. You take their details, you make sure they're comfortable, you explain confidentiality, how can I help? Then you have to remember that what you're doing to make a diagnosis is patients present with symptoms, earache, sore throat, abdominal pain, headache, tremor, palpitations. People don't present with diagnosis. So you need to learn the symptoms, what disease they relate with, and then once you've learned your diseases, how you differentiate those diseases. Otitis media, otitis externa, both have earache. How do you know the difference? Somebody with a dental abscess can have referred pain via the trigeminal nerve and the facial nerve, can have pain in the throat, could also have earache. How do I differentiate? You need to be taught this, and there's a right way to do this. I'll give you another story of one of my friends, owns a chain of pharmacies, around 50, 60 pharmacies. He's still a good friend of mine, and wanted to attend one of my courses, but wanted to attend the minor illness course. And I said to him, I said, bro, listen, if you're going to be doing a minor illness course, you're not going to be able to prescribe. And in addition to that, if you don't have access to clinicians and you're not learning and you're not educating yourself, it's difficult. He said, no, that's what I want to do. I even showed him videos. I explained it to them, wasn't interesting. So I then said, look, you know what, I'm not taking your pharmacies on, because you and me don't have the same, we're not on the same wavelength. 2 years, none of his pharmacists are prescribing. None of them. Didn't listen. Because you're not listening to how this has to be done. There's a set way. It's no wonder since 2004, 2006, pharmacists could prescribe. How many clinics do you see set up? Yeah, you can put it down to the fact that pharmacists have never needed to, but how many pharmacist colleagues, you have a look around, how many pharmacist colleagues would you say have the clinical skills and have the clinical, have the competence to prescribe? There's a difference in having qualification and being competent. Two different things. There's a right way to do this. It doesn't matter where you go. The key is educate yourself. So I just wanted to list everything this could be. This lady had a temperature, this girl had a temperature of 39, had a pulse of 106, could have been mumps, dental abscess, lymphadenopathy, a cyst, angioedema, could have been trauma, salivary gland stones, bacterial parotitis, could have been cellulitis. How would you make that diagnosis? You can learn all the minor illnesses you want. It's not that straightforward, but there is a right way to do it. So I wanted to share something with you now, briefly, and I wanted to show you some of my, some of the colleagues who were happy for me to share this with you. And I'm just going to show you the screen now and have a look at, Michael Ball. I don't know if he's on today. Hats off to you, Michael Ball. He's part of the Medland Mastery Program. And he had some wonderful words to say, and I thought I'll share this with you folks now. See what you think of this.
The course has been great for a number of reasons. It's been great to get around in a room with a group of people that are all like-minded, people got similar ambitions, really positive outlook for community pharmacy. It's been great to be taught by some inspirational people, some inspirational clinicians who, haven't intimidated, have just been very open and honest with their experience, and we felt very relaxed to ask the silliest of questions. future pharmacy, definitely, I think we need to shift towards more clinically focused, building on the level and depth of consultation interactions we have with patients. We can't compete with the likes of Amazon in terms of digitalization of supply of medicines, so we need to position ourselves where we as human beings can have those interactions with people. So it's all about delivering clinical service for me.
So this was one of my colleagues. Interesting enough, the idea for the Medland Mastery Program was actually stemmed from Michael, actually, who basically said to me that we want a structure from start to finish on how to develop our clinical skills, and can you take us on that journey? So, if he's listening today, thank you, Michael, for your support. And this week, everyone is going to be having access to the first week of the students on the Medland Mastery Program. And it's going to be really interesting to listen to their journey and their how week one's been for them. And I've had some wonderful feedback, and they're going to be, they're going to be recording their videos. It's going to be on LinkedIn. You can listen to their journey. Some of them have just been like, wow, there is so much to learn. It's great to be learning again. It's, to challenge yourself and test yourself. So, be prepared for that. I'm going to be sending that out there on LinkedIn. And so I'm really looking forward to that. And that should be great. Every week we're going to be doing a video so you can kind of stay with these students to see how they're developing. And, I'm really looking forward to their feedback. And yeah, it's going to be great. So what have we done then? So let's stop now and let's have a think. So some of you might be thinking now that I'm not a prescriber, so why should I bother learning my clinical skills? Yeah. And I think, Mohammed, who's on the chat today, who's on the LinkedIn, who was here earlier on, I'm not sure where he's gone now. Yeah, he's there, Mohammed's there. I'm not sure if Mohammed is a prescriber, but there are pharmacists who might be wondering this, that I'm not a prescriber, so why bother? Why not do my prescribing first? Let me make it clear to you. A lot of my benefit that I've had for patients and financially hasn't come from prescribing. It's not prescribing. It's giving people advice, and it's showing people where they need to go, who the best clinician to treat them is. It's giving people a holistic approach. Because what I've come to realize that the human body is if your immune system is low, if you don't look after yourself and eat right, it doesn't matter what medication you try. I don't care what you do. If your body isn't primed with the right nutrients and doesn't have the right, you're not feeding it properly, you're not giving it the right sleep, it no matter what you do, you're not going to be fit. You're not going to, if you develop, God forbid, the coronavirus, your body can't take it. You will develop something that we call glass lung and fibrotic tissue and scar tissue and so forth, because you're not giving your immune system a chance. So a lot of my consultations are holistic: weight loss, nutrition, giving them advice on being, on their mental health. And a small portion is now prescribing. Out of the £15,000 a month that I do in my clinic, I think more than 70–80% is giving them advice, telling them how they can improve themselves, how they can better themselves and improve their lives. So you don't need to be a prescriber. You could, in theory, you start to work in a GP practice. You could start to work in a pharmacy easy with your clinical skills. You could start teaching. You could start teaching and spreading that knowledge, just like I am. I'm not prescribing now. I'm just sharing my story. Another one is people won't pay. Why do you say that? Why do you say people won't pay? Why are you deciding for me? It's the same thing about my mastery program. People are not going to pay. I don't care what you think. Ultimately, let those people who need to pay, let them decide. Same thing with you and your pharmacies and anything you're doing. Stop telling yourself people won't pay. If that same person is going to go out there and pay £30 for a haircut, why won't he pay for his health? Why? If you're giving that person, look, if today I've motivated you and I've inspired you, you are going to come on this course, period, because we have the same belief, pending time and finances and so forth. If I'm giving you value and you feel what you're giving me value, you're going to come on the course. It doesn't make sense. Why not to? Because I'm giving you value in return. So stop judging the lottery ticket holder. Get that out of your head. Let them decide if they are not going to pay. You do your thing. You spread your knowledge. You spread your creativity. You spread your energy. You tell them what you want to do. Let them decide. Secondly, I don't have time. No one's got time. No one's got time. You know, I think I was speaking to Rihanaz and you know, she was honest and I agree with her. She said, look, I don't think I can commit to one of the mastery program courses because 6 months, you know, alhamdulillah, I'm busy with my family life and so forth. And I hope things are going well for you, Rihanaz, and I hope, you know, you're in good health. But I understand that it's not easy. You've got kids, you've got a family, but ultimately time doesn't wait for you. And that's why we've now developed a course that's not the mastery program, not 6 months, but it gets you on that journey so you can go on to develop your clinical skills and get that support that you need. Because I appreciate not everybody can have that time for 6 months. Some of you need just that support to get on the bandwagon. But time you have to make. If you look at my LinkedIn profile, I had a timetable of how I do my time, and I'm working 9 till 7 in my pharmacy business, in addition to everything else I do. So you have to make time. You know, I'll give you an example of myself. You know, I could have, and I tell my wife this, that I would have mastered my Arabic, even if I would have spent an hour a week for 3 years. I stopped. I kept telling myself, oh, I don't have the time. If I'm going to do this, it's got to be, you know, it's got to be 6-7 hours a day. So I eventually then stopped doing it, and I regret it now. 3 years have gone. Even if I would have spent an hour a day on my Arabic, I would have learnt my Arabic now. But I didn't do that. And now I'm restarting it again, but I should have made the time. So now that you've seen why it's important to take a history, you also understand why this is the building block to your success. I'm sure you're happy for me to help and support you regarding this. So with your help, I'm going to show you how we're going to support you and help you. So we've developed a course that is specifically designed for pharmacists, and this is what we offer. So in this course, which is delivered by a webinar, and it's delivered over a range of different days, and we'll discuss that in a second. We offer you applied clinical history, physical examination, and introduction to minor illnesses. It's normally priced at £1,500, but we're doing a limited offer for £997. We give you access to SOPs and consent forms. So every single consent form, from physical examination to clinical history, you will have access to that. We normally do that in our day's course. It's at £500, but we're giving away that for free in this course. Mentoring throughout the course. So it works out, you know, throughout this course, and when it works out to around, I think it's over a span of 4 weeks. And I'll go through that in a second, how that works. You have access to a WhatsApp group, you have access to real life case studies, and you have access to discussions with myself. And again, and we normally have that on our mastery program priced at about £5,000, but it's given away for free this time. You have access to videos designed for pharmacists, so cardiovascular, peripheral, respiratory, ENT, neurological. We will be giving you videos that show you not only how to do the physical examination, but how to apply the knowledge. When you look at someone's hands, why do we look for clubbing? Why do we look for, why do we look for Janeway lesions? Why do we care if your hands are warm? Why are we looking in the eyes in the conjunctiva? Why are we looking at the oral cavity? Everything explained to you from start to finish. So, you can look at Emma Cloud's textbook. They will teach you how to do a physical exam, but they don't relate it for you because that you have to do yourself. But we teach you that. If you have a patient who presents, we go through that whole step from start to finish, how you relate that, how you relate your general examination to your patient, how you relate your cardiovascular findings. For example, let me give an example. And after this, any one of you can answer this to me, but why do we listen to the mitral valve at the apex? If you want to listen to the mitral valve, why do we listen at the apex? because the mitral valve isn't where the apex of your heart is, where the tip of the heart is. It's not there. Why do you get your stethoscope and place it there? You can research it, but you will spend hours finding that information. We explain that to you, why you put it at the apex, why you put your, when you listen to the tricuspid valve, why you put it at the, the fourth intercostal place, left parasternal border, why you put it there. Why is it that if you want to listen to the tricuspid sound, it's at that, and you don't listen to the, why, not the apex beat? I ask people, tell me how you generate the first and second heart sound. And they say to me, oh, it's the closing of the mitral and the tricuspid valve. Good clinicians will be happy with that. A great clinician understands it's initiated by the closing of the mitral and tricuspid valve that causes vibrations in the blood column that leads to the first sound loop and the second, the S2 sound loop. Again, we explain this to you because we go through anatomy, we go through applied anatomy, applied physiology in this course, and I'll go through that in a second. We give you crib sheets, so you have an algorithm and a step-by-step guide to know exactly how to do a history and a physical exam. You get access to templates of a physical examination, so you can record everything to save you from litigation. So if I saw, I don't know, let's say I saw Mohammed on the chat, or Isha, imagine I was in an examination with Isha, and in 3 years' time, she pops back and she goes, actually, I think that that examination that you've done, I wasn't happy with that. In actual fact, I want to sue you because you didn't examine my cranial nerves and I can't hear properly now. What leg would you have to stand on if you don't have the paperwork? We provide you with every single paperwork that you've done, so you're litigation free. And you can actually, madam, I did XYZ. You've signed for it, everything's there. So all the crib sheets on a general examination, cardiovascular, peripheral, respiratory, ENT, neurological, all there. You'll fill it out, you'll get the patient there, it's all done for you. And we normally price that £1,500. That's also free in the course. I give you a step-by-step guide on how to diagnose a sore throat, earache, hematuria. How do you differentiate between a sore throat, viral, bacterial, earache, otitis media, bacteria, urine? How do I give you a step-by-step guide and algorithm to show you that? Again, that's free as well. You get access to anatomy and physiology webinars. It's so important for you to understand your anatomy and physiology. And I've just explained that to you now. If you don't understand your anatomy and physiology, you will never be able to relate your clinical history and physical examination to real patients. It's impossible to do that. And we go through that with you, so you don't have to spend hours on some of the textbooks that I have, which are, this book in front of me is like 1,119 pages. It's taken me 3 years to sit and learn it, or you don't need to do that. And some of it's not even relevant to you. It's not relevant to you. Again, we've put that at a discount price at £899.90. You have a video explaining all the opportunities that you have. All the opportunities that you have. So everything that I've done, I break it down for you in a video so you can benefit like I have. Signed up 10 patients on our mastery program for £14,000. Alhamdulillah, we've already got 5-6 students signed up to this course starting on the 7th of April. Okay, so you can do this. I've been offered to speak and talk at the pharmacy shows. All this, I can explain to you how you can do it. And an optional add-on, which I've added on, because a lot of pharmacists have got in touch and said, could you help and organize a DMP? We used to do it for £4,000, but it's at £2,299. That's an optional. That's if you wanted to. Okay. And with that, we help you applying at university, your personal statement, support with your essay, writing application form, helping you with master's level study, access to my personal statement, and guiding you through everything that you need to do, and mentoring with the doctor. So this course was priced at £11,590. If you include the £4,000, it was coming up to 15K. We now have it at £1,896.90. If you were to go through, but then you say, look, I can't find a DMP, I want help with that, then that's an optional add-on, and that works out to £4,195.90. But this course is starting on the 7th of April. We deliver it via a webinar. So it's delivered in the evenings. And I appreciate that we can't have students sat there for 10 hours on a webinar because it's not possible, sat there 10 hours. I'm fidgeting now because even I'm like, I'm sat in this position for nearly an hour and I'm starting to get cramps. Maybe I need to look into my diet, right? But the point is that we do it at your time. So we do it normally between 7:30, 8:30 in the evening. So 1 hour on a Tuesday, I think it worked out to 1 hour on a Wednesday, 1 hour in the evenings on a Friday, 1 hour Saturday, 2 hours on a Sunday, I believe, and the same thing the following week. So the anatomy and physiology takes 2 weeks because I go through that in depth so you understand it. You have access to my videos. You can watch it again and again. We then spend 2 weeks applying your clinical history, physical examination, and minor illnesses. So at the end of it, you have a good understanding of where you take your learning next. And that is at £1,896.90. Okay, it starts on the 7th of April. For those students who can't attend the 7th of April, it's bespoke. So you could, in theory, give me dates that are good for you. We can start it then. But it would be better if we can couple students together because you can learn a lot more. You can learn a lot faster and you can learn from each other. If you wanted us to organize your DMP and organize the non-medical prescribing for you, then that's an extra £2,299. But bear in mind at the moment, I think the earliest that non-medical prescribing is going to be happening is probably in September, not before that with the COVID situation. And even then, I don't know if that's going to go ahead, what's going to happen at the moment. But the teaching is at 1896.90. You get access to your consent forms, SOPs, insurance, helping you with insurance. You get access to teaching at your time, your place. You get mentoring, you get real case studies and proper live, where we can demonstrate live with patients if we can, but you'll have access to real life case studies and pictures and videos, because there's one thing you're reading a book, but there's one thing you're seeing patients. So with patients' consent, I have a huge database of pictures and videos and so forth that you can see to help you. You get access to crib sheets from all the different examinations. You'll have those sheets in front of you, and we're going to go through them in depth so you know exactly how to use them. I also have a video showing you how to do the examinations, and then we give you an in-depth guide that goes through those videos so you understand, okay, why we're looking for clubbing, why we're looking for, how do I know if this patient has splitting of the heart sounds, what is S3, what is S4, the whole thing's going to be there for you. In addition to that, we go through sore throat, earache, hematuria, give you crib sheets and algorithms on them. We look at common minor illnesses, UTIs, earache, sore throat, sepsis. I think there's a whole list of them on the website that we go through. I give you a video on how to demonstrate and you put your skills into practice. And if you need help with your DMP, it's all there. And that is priced at 1896.90. And actually, this is not intended, but I'm just going to unmute Mike and get his feedback on his first week of the mastery program. Mike, I've kind of put you on the spot, but can you hear me?
I can, yes.
So do you want to share what's it like on your first week? How are you keeping? What have you learned?
It's intense, but it's been quite remarkable. My approach, my thinking to this has radically changed in the space of a week. Yeah, quite remarkable.
And if there's any advice that you'll give these students on history taking and physical examination, could you shed some light why you've learned that's so important now with the case that you've done on the Ramsey Hunt? Why is it so important to take a history to a physical exam?
So, I think we can become quite obsessed with features or characteristics that we see all the time. And what I've learned in the short time so far is the importance of not being generic. It's about being specific, but also understanding that more often than not, a lot more often than not, it's going to be something that's expected rather than out of the norm. So it's not looking for the weird and wonderful. It's following a process, following that process strictly, and it's not looking for not looking something that's totally out of the ordinary, but equally it's not looking for generic characteristics, generic traits. Yeah, a lot to learn yet, but it's a change in mindset that I think the penny's finally dropped with me now. So a lot of learning, a lot of reading, a lot of discussion with peers. The peer pressure really helps for sure. Yeah, just very excited to be on this course.
Thank you, Mike. Thank you. So Mike is on the mastery program. For those of you who are not aware of the mastery program, that's a 6-month course, but I will, now that he's here, but it's Mike was my inspiration to develop the mastery program. I had no intention of developing that course, but it was the feedback that I received from Mike that kind of prompted me to develop the course. And you know how much I've learned from being surrounded by some of these people. Let me tell you one, I'm just gonna do a Q&A now. Being associated with people that have the same mindset and same drive gets you from A to Z a lot quicker. And that's the advantage that I have, because I'm around people like Mike, who is, alhamdulillah, with God's will and hard work is an inspiration. He's doing extremely well, not only him, but Darren, all the students, the doctors, my brother who's on the chat today, who's listening to me, I must get sick of hearing my voice all the time, Basim, and my other brother Adnan. You need to be associated with the right people to achieve things in life. You can't do everything on your own. It's impossible. But if you are with the right people, again, Tawfiq, hats off to Tawfiq, who's one of my mentors and still is. And if it wasn't for him, I wouldn't be doing what I was doing, because he taught me how to run a business. And I'm going to quickly kind of go with Tawfiq. Can you hear me?
Yes, I can hear you.
Tawfiq, what advice would you like to give to all pharmacists, just generally, what advice would you like to give that you gave me going back nearly 10 years ago when I learned from you?
Well, I think the writing is on the wall for all of us anyway. The landscape is changing. Soon, whether we like it or not, the profession is going to be divided into people that are providing services and distribution. And for me, I believe we didn't go to school to just go and be putting signature on the boxes. We want to make difference. We have this knowledge, these skills, and we need to monetize it as well. We need to be out there. So I think it is high time we start taking our rightful position in the community as the first medical professional that they encounter. And it must be meaningful. When someone comes to you, it must get that experience that they've spoken to a pharmacist, not some healthcare assistant or anybody else. So how do you do this? You need to equip yourself. You need to have that drive. And like what Fahim said, anybody can do it. Just as I said, you can do it and it will be possible.
Spot on. I mean, I just want to say, and I've never had a chance to actually say this live to, while Tawfiq is here, but if it wasn't for, first of all, God's will, my family, my brothers and sisters at one side, but this gentleman has changed my life, and I worked for him for 6 months, and he taught me everything I had to learn about running a business. And he never, ever in his life did he say to me, I want to teach you how to do this, or never hid anything. So again, you got to be associated with the right people. Tawfiq is just an example. And if it wasn't for him, 10 years ago, I worked there with Tawfiq. And up until now, I will always say that he's my mentor, he's my teacher, and I have that great respect for him. And it's quite emotional to be here now with him being here, because, there are two people in your life who are never jealous of what you do. Your parents and your teachers. Remember that. Never jealous of what you do. Everyone else, brothers, sisters, friends, whatever, although my brother's here, we love each other, but there is that element of that, you have that, competition. Teachers and parents will always want you to do well. So Tawfiq, thank you for everything. I can never repay you back, but I can pray for you and thank you for everything. Right, folks, question and answers. has anybody, if you know, this offer is limited time, so we've got it for, you know, we had it on last week for 24 hours. We've got it on again for 24 hours. You know, we are looking for 10 students. We have 7 students who've signed up. So I think we've got 6 or 7 students who have signed up. 10 students we're looking for in the, you know, and it's at that price at 1896.90 to sign up. And you can do that by visiting that link there, or my number's on there. Get in touch with me directly. You know, Rehanaz, Mohammed, you know, Anika, my number's right there. Get in touch. And any questions you have, I'm happy to answer them now. We can put it on the chat if you've got any questions. And if we don't have any questions, then I wish you all the best of evenings. And I'll leave that slide up for a bit for you to have a look at. Stay safe. God bless you all. And I look to working with you shortly. I think we are, yeah, no questions, we're done. Thank you very much. And may God bless you all. Thank you.